In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, everybody? Ladies, gentlemen, got another addition to my snake oil file. Got a doctor down in Houston who has an interesting story, and we're going to listen to what she has to say about some information that she was giving out to her patients that wasn't quite what is recommended by her governing body, the American Medical Association, her state medical board, medical boards all over the United States. I'll let her speak for herself as far as why she did what she did, but we'll talk about it. But I appreciate you guys sticking with me. Please like, share, and subscribe. Doesn't take but a moment for you to hit that like button. I've got quite a few people, thousands looking and coming through, but no one hits the like buttons. I get, hundreds of likes, but I have about 25,000 views. And if you guys like what I'm doing, if you support the channel, then please, hit the likes, so I can please the algorithm gods, So without further ado, let's explore the rationale of the good doctor. Okay. This is fair use, everybody. So we will look at what she has to say. Again, fair use. This was from a Houston television station that took her press conference, and we'll go through it a little bit.
Go ahead. Okay. Hello, I'm Mary Tally Bowden. Believe it or not, this is my first press conference. I ask you to be nice. I have four very protective boys that know how to access my Twitter account, and they have no filter. So please be nice.
Okay. So what does that have to do with anything? Is that like a threat or something? Is that, is her sons are going to come after you if you basically say that she's doing something that could potentially put people in harm's way and using a medical license to do it? Okay.
It's hard for me to believe that I'm sitting here. About a week and a half ago, my frustrations came to a head and sent an email to my patients. And I'm a small practice. I'm a solo physician. I've been here for 2 years. I started off with the intention of just doing ear, nose, and throat and sleep medicine, and somehow stumbled into COVID. I was just responding.
You guys pay attention to that. She's ears, nose, EENT doctor. So eyes, ears, nose, and throat. Okay. So she what her specialty is outside of COVID, She does sleep medicine, so she does have some pulmonary experience and practices to a limited degree with that. But she started treating COVID patients, and that's outside of what she normally does. So these people asked her to basically just do COVID testing, not to treat the patients, but to basically test them to see if they had it. And let's see what she did.
Responding to what my patients were asking me to do. They wanted to get tested because they didn't have access to testing. And I found a way to do that. And I never rationed testing. I provided access when access was hard to come by. So over the span of the pandemic, I've been open 7 days a week. I've tested over 80,000 people, and I have treated about 2,000 people. I'm a good doctor. I fight for my patients. I treat my patients the way I would want myself treated. I've been on the other end of the patient-physician relationship. As a mom of 4 boys, I basically spent 5 years as a patient, 5 straight years of pregnancy. So I know what it's like. And when I opened this practice, my intention was to treat people the way I would want to be treated as a patient, and to treat people the way I would treat a loved one. And that is how I have.
I want you guys to pay attention to her demeanor. And I want you to ask yourself if she feels like she did the right thing by her demeanor, her response to all of this. She's a little bit emotional to me, and I'm just going to save it to the end. I'm going to save it to the end. You guys go ahead and when I'm going to probably pop in occasionally and cue you in on key things that I think that are important.
I've treated my patients during COVID. So it was quite a surprise to me last Friday when I got a text message from the Houston Chronicle telling me that my hospital privileges had been suspended. It's not the way things like this are normally handled. I had very loose ties to Methodist. I only have privileges there in case I have a patient that is so sick that they need to be hospitalized. And I'm proud to say that because of my early and aggressive treatment for patients with COVID, I have not needed to admit anybody to Methodist.
So basically, rather than testing these individuals and referring them for treatment, you'll see that she went a totally different way. She chose to start treating the patients with treatment methods that were not recommended by her state board of medicine and by national governing bodies or the CDC for treating COVID. And she went so far as to get involved in a lawsuit to where she could come inside of a hospital where she didn't have privileges to go in and try to treat a person with ivermectin when it goes against the state's recommended treatments and national recommended treatments for COVID. And you'll see that she got, well, let's go.
So I'm not quite sure why I became their target, although I think based on their history of being the first hospital in the country to mandate vaccines for their employees, that they are using me as an example based on what they have read, which I have not sent to them, but I've.
Okay. So right here, I mean, you'll see that she's going to say later on in the interview that she wants to take the politics out of medicine, but clearly she's being political here. And she's upset because her privileges have been yanked for the hospitals surrounding her. because of her choice to use off-label uses for ivermectin. Ivermectin is used to treat parasitic infections and not for COVID. There is no evidence anywhere in any study that's reputable that states that it works for the prevention of COVID infection or treatment in any way. And I dare you, anybody, to go and find me something that's reputable, that is peer reviewed, that states that ivermectin is a treatment that is viable for COVID-19 or Delta or Omicron or whatever is being treated. Okay. She also started treating people with monoclonal antibodies. And my question to this is: you're an ENT doctor. You're out of your lane. You should be referring those people to treatment inside of the hospitals instead of running your small practice of, you know, how many thousand people that she's got. You know, she should have maintained what she was doing. If she was going to test, that's fine. You know, but I think that she got into this because it was a lucrative situation for her to make a little extra money, and she capitalized on the current state of hysteria in the world regarding this virus. So let's move on. Let's hear what she has to say.
Sent to my patients, and I have vocalized on Twitter.
Okay. Yes, she was making tweets, unprofessional tweets, and unsubstantiated tweets, which she's using her medical license. And by using your saying you're a doctor before that, you're using your license to basically push people in a certain direction, and they took issue with it. Now, she was going so far as to tweeting out this, you know, to these people as if it was, you know, patient information, which is, you know, we all as medical professionals are supposed to teach people based off of the science and based off of the information that's out there. And you'll hear her say that she has no data and no information that leads her, that she can provide, that substantiates her use of ivermectin as a treatment or monoclonal antibodies. So let's move on here.
Since when is that a reason to take away somebody's hospital privileges, try to take away their license? I'm not saying Methodist is doing that, but there are groups that are targeting doctors like myself that are just simply trying to speak about what they are seeing. And I don't have research papers to back what I'm doing personally. I have tons of data.
Okay, she has tons of data. Okay, so, you know, I would take issue with that because data has to be collected in a certain way. Are you a researcher or are you a practitioner? You know, in what venue was this data collected? You know, was this data collected in the proper way for it to be used with regard to ethical treatment in patients? All of that has to be met in order for you to use this information that you have to say that, hey, this is a great treatment for, you know, for this disease, you know, or this virus. You know, she says that she tested 80,000 and she treated 2,000 and she kept them all from going to the hospital. Okay. Now, I doubt that that's real, but that's her take on it. So let's move on.
Tons of clinical experience, and when I speak to my patients about what is going on, it is based on my clinical experience, and that should be good enough. And I'm not sure in this day and age, apparently it's not. It's astounding to me as a physician that I'm not entitled to my medical opinion.
Okay. And you have to be very careful with that, because your medical opinion has to be based on fact, and it has to be based on what is the consensus on how a certain thing should be treated. You can't just go out into the weeds and just start treating people with dandelions. But she's clearly moving from a political standpoint, which a lot of people are saying that this is not political. It is very political. And you'll see which side she's leaning on.
I think this is hopefully, this is not how I wanted to be. I would like to go back to my clinic and stop. I do not want to be in the media, and I do not appreciate the way Methodists handled this. I'm simply trying to help my patients.
So, doctor, why hold a press conference?
Because my name is being vilified. I have people leaving fake reviews on my website, all over the media. I have people calling me a sister of the devil and misconstruing my intentions. So I want to set the record straight. I don't feel like I'm getting fair coverage of my side of the story.
Dr. Bowden, I guess the issue from Methodist standpoint, some of the people online, is that you're using ivermectin, which has not been proven effective by the FDA against treatment of COVID-19. I guess kind of explain to us why you have used it to treat patients.
Well,
You see how the tears stopped? The tears just instantly stopped. And now she's gonna try to convince people that ivermectin is a treatment, even though everything out in the public states that it is not has no efficacy with regard to COVID-19.
when I did a survey of all the patients that I've treated with monoclonal antibodies.
Now she's about to lie. So why would you do a survey to see who all's taking ivermectin? I just don't understand what your motivation would be for that.
And I asked them what medications they're taking. 30% of them said they are taking ivermectin, which is a large number of people. I don't know how ivermectin has become a dirty word.
Okay. Now, she had an opportunity, and my question would have been, did you tell them that they shouldn't be taking ivermectin because ivermectin is not a recommended treatment for COVID-19? That would be a responsible move that a doctor should take. But she didn't do this, which shows that she was an advocate for it in the first place.
It's a safe medication, and I would never give anything to anybody that I thought was going to hurt them. And I did deep research into whether or not I thought it was going to hurt them. So I stand by ivermectin. I have plenty of people who have taken it, and no one has had a serious reaction from ivermectin. Again, it's clinical experience.
Okay. She says no one's been hurt by it. Okay. So that Hippocratic Oath says to do no harm, but you're gonna give somebody something that doesn't work, but you're just gonna give it to them. What was the reason for you give it to them if it doesn't work for the disease in the first place? Are you trying to give the patients false hope? Are you just trying to treat them and basically charge them for something that doesn't work? Okay. 30% of her patients were taking ivermectin, but she didn't prescribe it to them. That's what she says now. But she later states that she did prescribe it. So you'll see that she's going back and forth. You didn't give it or you did give it. And if you did give it, then it's not authorized for off-label. That was passed down by the CDC when they first started having people trying to take ivermectin. So it's not even authorized for off-label. So you could go to your medical board, and your medical board could suspend your license, just as they've done with 2 other doctors that I've already done shows on, that have they've either lost their license or either they've died because of the information that they were living by and giving to their patients.
So the 30% of patients that you surveyed, are they the ones that you treated with ivermectin or others?
No, the 30% of the patients that I've treated with monoclonal antibodies all told me they were taking ivermectin at the same time.
You believe that?
Continue doing what I'm doing.
So she wants to continue basically treating people with something that doesn't work, that clearly her state has a problem with, because they've taken her privileges from her, and they've also released it to the media to put additional pressure on her, because there's been some concerns that have probably been flooding her medical board and the hospitals, because she's using ivermectin and monoclonal antibodies, and they're not recommended for the treatment. So either you're going to abide by the rules, or you're just going to make up stuff and become a snake oil salesman. You can just go out and just put you some colored fluid inside of a bottle and just start giving it to people and say, hey, this is your willy-nilly, fancy-dancy cure for COVID-19.
Considering any kind of legal action against Methodist at this point?
I'm not going to comment on that.
Have you had any conversations with anybody at Methodist directly, either?
No.
So all of this has happened through social media or what you've
Well,
read?
they have sent me official letters, but there have been no conversations.
Because they don't want to talk to her. They don't want to talk to her. She's out here. She's all in her feelings because she can't do what she wants to do. But you got to go by the rules. You got to go by the rules. You got to treat people the way that they're supposed to be treated. And you're a EENT doctor and a sleep medicine doctor. You're supposed to be treating sleep medicine and, eyes, ears, nose, and throat. If you see something where, a person has COVID, you're supposed to refer them to the hospital to be treated. If you're in any other hospital, here in my state, if you even suspect you of having COVID, what they're going to do, they're going to send you to the emergency room. You have to go through there and be processed and be cleared, or, be taken in for treatment. But she's taken it upon herself to basically treat these people and, send them on back to the house and give them monoclonal antibodies and ivermectin and, probably some roots and berries and, magic salves and whatever else she's got over there to make sure that they are treated so that she can get paid. Here we go.
Do you plan to have it?
I'll have to ask my lawyer. I don't know. Well, Methodist has touted itself as the example that the rest of the country should follow in terms of vaccines. But why are they not sharing with us more data? Why do we not know how many breakthrough cases they have? Why do we not know how many patients who have been vaccinated have had side effects? Why do we not know a firm number of the patients in the hospital who are vaccinated?
Listen, she doesn't have to. She doesn't have to do this. Now she's talking about a firm number of people who are vaccinated, but you're going to see here later on, she won't confirm her vaccination status because she says that it's private, personal information, health information. Okay. But she wants to know everybody else's vaccination status, so you'll see that she's not being very genuine, with any of this. And, she says that, okay, I want to see all your data. But she says she doesn't have any data. And what's the bigger question here is, what does that have to do with you treating people with something that has no efficacy for treating the disease that you're supposed to be treating? So this is basically moving the goalposts, ladies and gentlemen.
So if they want to be the leaders in COVID, then they need to share all the data. They also need to...
Breakthrough cases from state to state have already been released months ago. 90%, 98% of the people who are being treated in the emergency rooms are people who have not been vaccinated. They're not breakthrough cases, although there are some breakthrough cases, but those breakthrough cases are happening because it's time for boosters. So the shots are wearing off. So now they're starting to see that the data is indicating that it's time for boosters now. Now, she's a doctor. She knows this, but she's pissed off because she's not being able to get her way, which even though you're a doctor, you work for the hospitals. You work for another structure and organization that you have to function within, but she's a crusader. So she's trying to basically do her own thing and basically throw mud in the eye of these organizations. But this never, ever ends well. I suspect she'll probably be moving to another state soon.
Perhaps not vilify doctors who are challenging what the vaccine movement.
And look, this happens to doctors, it happens to nurses, it happens to respiratory therapists, it happens to anybody. If you go out there and you start passing information that's not supported by the majority and the majority of the scientific community and health community, you will not have your license for very long. That's why you have a license, because you have a governing body that oversees you and makes sure that you stay within the guidelines and continue. You have to get continuing education and all of that in order to maintain your license. So if she wants to know this data is out there. She's just not looking for this data. What she's looking for everything outside of the data to go against how she feels, because I've had this conversation with other people and nurses and some doctors just talking. And the whole thing is, I don't want anybody to tell me what to do. It's childish. That's what it comes down to. It's childish, and it's people have gotten into this. We're free. No one should be able to tell me what to put in my body, but you tell people that they can't smoke weed. You tell people they can't snort coke, and you're okay with that. But now when it comes down to this, you don't want anybody to be able to tell you what to put in your body, So next is it going to be, no, I'm not going to take a urinalysis, because the minute that you do that, you're going to lose your license, and you have to do that when you're in school before you get ready to practice or to work. You have to be immunized. You have to show your immunizations in order for you to work. Okay. PPDs, to show that you don't have TB. You have to have all your immunizations, because you work around sick people, and your likelihood of becoming sick, hepatitis, whatever the case may be, your likelihood of being exposed to it is greater than the public at large. So you have to take extra precautions. It is what it is.
I have a question. So the people that came, you said you treated people for COVID, am I right? Okay, so that treatment ever included the vaccine, or it was just?
I tried to get the vaccine to my clinic when it first came out, and I could not get it because I was not a hospital. I basically felt like I was being...
Right. And you felt like you were being kept from being able to treat your patients. All you had to do was, okay, my patient has COVID. I'm going to refer them to the hospital for them to be treated, to get the vaccine if they choose to, or if they don't choose to, but it's out of your hands. There is a clear treatment and direction that this patient should have gone to, but she chose to go her own way, and she's pissed people off.
I was too small to be worthy, so I just gave up. So
see the words that she's using? Be worthy. You're a small practice. You do what you're supposed to do, which is what you're doing. You know, eyes, ears, nose, and throat. Hey, that is basically within the realm of you testing people. But COVID is a systemic damaging situation. So that person needs to be treated in the hospital, assessed through the hospital. You refer that patient out. Oh, you've got COVID. I'm going to refer you over to the hospital, and you go on about your business. You know, you shouldn't even be trying to give immunizations or any of that. If it's going through the hospital, you just bow out and say, okay, I'm not getting it, and it's through the hospital. But I'm just feeling like her motivation is she feels like she should be able to do everything. But the system has never been that way for one person to be able to do whatever they want in it. You know, you have a team approach towards treating these patients, which is, okay, if I'm doing my part, then I refer them over to the next part, and the next part gets taken care of. You know, if I'm not a heart doctor, I don't treat, lung issues. I refer them over to pulmonology. Okay. You know, if I'm a pulmonologist, hey, I refer them over to cardiology if they've got some heart problems. If they've got multiple systemic issues, then chances are they're going to be in the ICU, where everybody rounds through there, and each one of those doctors from each one of those systems will come in and address those issues. That's the way it works. I don't understand why this person, this individual, is so motivated to do everything in her clinic, her small clinic. Keep that in mind.
No, I don't distribute the vaccine.
So I do take that. You wanted to give the vaccine out.
Yes, I was on board with it. I tried to get it, and they were just giving it out to the hospitals.
You have nothing against the vaccine?
Nothing against the vaccine. I don't think there's a one-size-fits-all for the vaccine, but I have nothing against it. There's certainly an important tool against this pandemic.
See, she thinks it's an important tool, not the only thing. So she wants to continue treating with other things. But again, she has no data to support what she's doing. Remember that she said that. She said that in the beginning. And she's being kind of strategic with her words, but she's let a few things slip that basically has destroyed her whole argument. And her lawyer is sitting there next to her, and I don't know why he allowed her to do this, but here we go.
Did you take it as part of Methodist's requirements?
That is not something, I don't even ask my patients that, and I am offended that other people would ask me that. It's a HIPAA violation. It's a personal. Okay, now she got in her feelings again, and look how angry she is about whether she has taken the vaccine, which that's a clear no. She didn't take it, and she doesn't. She says she has nothing against the vaccine, but then she said at the end of it, but it's not the only way, which means that that's not the way that she's gonna send her patients to. And she's probably unlucky. She probably hasn't had anybody die, or she's not going to take credit for it. So that. So she's saying that she doesn't ask her patients if they've been vaccinated. Why would you not do that? That's a part of assessing your patient for something that could possibly impact one of the areas that you cover: eyes, ears, nose, and throat. You're at the upper end of the respiratory system. So you need to be asking your patients that. So if you're not asking your patients that, then, are you really assessing your patients properly? Health information.
Oh, and again, she wants everybody to release all the information, but she doesn't want to give any information. Okay. And she has no reason, no studies, no nothing to point her in this direction. So what caused you to make the decision to go in this direction for the treatment of your patients? If it's not science, what is it? Now, she's being boosted up by the crowd. So you see that there are people out in the crowd and that are out here that are supporting her based off of their feelings, not off of science. And that's a problem. If we don't trust people who basically do this for a living, and you're basically just going to go up and, lick your finger and stick it up in the wind and go, hey, I'm not going to go with that today. That just doesn't feel right. That makes more sense than going by the science and the studies that are out there. Then there's something wrong with society. It really is. And society's whole concept on freedom has become retarded.
On your website, you said you were on staff at Methodist as well as Memorial Hermann Hospital.
I have privileges at 2 surgery centers through Memorial Hermann.
Memorial Hermann.
Yeah.
They said you did not have any privileges at acute care.
At the hospital, no, the surgery centers.
Surgery centers. And you see, they said that you have no privileges in acute care. But COVID is an acute care situation. And you're trying to dabble in acute care, but you have no privileges in the hospital for an acute care setting. And if she has surgical privileges, it's dealing with EENT issues and sleep medicine. So you're out of bounds. You're out of your scope.
So you said that you treat 30% of your patients, right? 30%, is that right? 30% of your patients were treated of this COVID? Is that what you said?
Yeah.
30%?
Wait, what?
30%
Of what?
of your patients were treated of COVID, right? COVID? Is that what you
So she's acting like she doesn't hear this guy. He's saying that 30% of her patients were treated for COVID, but he's saying COVID because he's Hispanic. So, but she's acting like she doesn't know what he's saying, but she knows what he's saying.
said?
30% of the patients were treated for COVID. That's what he's trying to
Is
say.
that what you said, right?
I don't understand. No, I don't.
So you said 30% of the patients surveyed said that they use.
No, 30% of the patients that I treated with monoclonal antibodies were taking ivermectin at the same time. Not for me, just.
See? Oh, not for me. And she's going, hey, but you support ivermectin, but you didn't give it to him. Why are you coming out and saying that you support ivermectin? If you didn't give it to him, it just doesn't make sense. It doesn't make sense. I believe she did give it to him. I believe she did prescribe it to him. I believe that she was using the monoclonal antibodies too. But if you're using monoclonal antibodies and you're using ivermectin, how do you know what's working if you're using two different things that aren't even working, that aren't even recommended for it? And how do you know that the person just didn't get over it on their own? You don't, because there has to be a study that shows what the efficacy is for using ivermectin with nothing else in the person's system. Okay. That's how you do a study. Or you just use monoclonal antibodies and you show whether that person's getting better based off of lab work and all kinds of testing and monitoring of those patients real time. They're never outside of your view. Okay. It's not sending them home and letting them do all of this and come back into the clinic and let me talk to you for a little bit. It's not that. Okay. So she's being disingenuous here. You guys keep watching.
Happened to be from other physicians.
Oh, but they were not from you.
No. Well, maybe some of them were, but I don't know.
Oh, maybe some of them were. But you can't have it both ways. You can't say that you didn't give it, but you did give it. You know what I'm saying? I mean, what's her lawyer doing here? If they decide to suspend her based on her using this in an off-label way, then it's not going to be good. She's basically damning herself with this interview.
You are listening to Abuki Cabal, the analytical savage.
I mean, a lot of these people just come to me because I allow easy access to monoclonal antibodies.
Doctor, you up there on the forward.
Okay. You allow easy access to monoclonal antibodies, and that's outside of what you do. It's outside of what you do. So why are you in monoclonal antibodies if you're not in the practice of treating people for COVID? If that's totally outside of what you do. You guys look up eyes, ears, nose, and throat doctors and what they treat and you look up sleep medicine doctors and look at what they treat and see if it coincides with something with the same people who treat systemic disease. They're not. I've been in this for a long time. I've never seen that. Never. You know, I don't know if there are any doctors that are listening to me, but I mean, you guys can cover that in more detail if you'd like, but I've never seen this. And she's way too gung ho to be out here trying to treat something that's way outside of her practice. I mean, I don't know, that's just the liability alone should be enough for her to stay out of that. So let's keep listening.
So I have a patient in Fort Worth at the Texas Hughley Hospital, a 48-year-old man, family, father of 6, sheriff's deputy. He's been in the hospital for over a month. He's been on a ventilator for over a month. His wife reached out to me to try to have me prescribe Ivermectin because she wanted to try everything she could to save her dying husband. I agreed, and then she had to have a lawyer get involved because the hospital refused. So I testified on behalf of my patient, and we
testified on behalf of the patient who is not really her patient, but she stepped in because she was asked to by a family member. So yeah, she's a doctor, but she's not the patient's doctor, and she's going against everything that was recommended for the treatment of this person who's already in the hospital. So she got involved with this and sued the hospital in order to get privileges so that she could not go in and inject the person herself, but to send a nurse in to inject this person with Ivermectin for this person to get better. She's not going to monitor the patient, nothing. She's just going to go in and give the person Ivermectin and let the hospital deal with the consequences, if there are any consequences that are detrimental to the patient's health.
On the case, and the hospital was told to grant me temporary privileges and do it quickly, and unfortunately they decided to stall, and they waited until that Friday afternoon when I sent the email to my patients to tell me that they were denying my requests for temporary privileges. And this is with, I have a clean record, I've never been sued, no complaints, so there was no clear reason why they would deny my privileges. The lawyers went back to the judge and they said, okay, well, we'll do the privileges, but with some modifications. We'll only grant you privileges to only administer ivermectin, and you have to come and do it yourself or have a nurse do it. No one on our staff will actually give the ivermectin. So I agreed, we did that. Apparently, and then we lined up a nurse to come give the ivermectin. The nurse came to the hospital and tried to get in, and apparently the hospital had issued an appeal, but this was not given to the patient's lawyer yet. So she thought she had her every right to be there, and the hospital called the police on the nurse and had her escorted out of the hospital because she thought she was following a court order. We could not clarify what was going on the next day because it was Veterans Day. The following day, we found out there was a stay on the order. Today, that appeal is being processed, so we're hoping to have an answer tonight or tomorrow morning. The patient is stable, but he's still on a ventilator. And you said that
So she's treating a patient who's clearly in an ICU setting. She's not an ICU doctor. She's not. She's not even supposed to be in there. But they bent to it and they allowed her to go in and to do this. The patient and the family members are clearly scared to death that this man's going to die because he's on a ventilator. and he's probably not looking well. So they're begging for anything. And that's what happens. You forego getting immunization, and then by the time you're on a vent, you're going, please just give me anything, please, just please, and they'll drink mop water if you give it to them. But that's not what you're supposed to do. You're supposed to treat these people as a professional, not get in your feelings, and you're supposed to do your job. But clearly people are not as professional as they need to be.
Because of the Texas Children's the hospital, because they were the first hospital to mandate vaccines, they were trying to make an example out of you. Can you please elaborate on what you meant by that?
Yeah, so she's saying that they were trying to make an example of her. She's just a small fish, and that's just, she's being disingenuous. What she's doing is like being in the middle of the ocean and lighting a torch. There's nothing else around you except for you, a big bright object. And that's what she did. She put the spotlight on herself by treating people with something that was not recommended for the treatment of the disease in question.
I am a solo physician. I have a few thousand patients. I am a flea on the elephant of Methodists. I am not a threat to them. Don't quite understand why they need to single me out with this.
You're not a threat to them, but they see you as a threat to their patients. And that's what they're in the position of doing, is protecting their patients. And if there's a doctor that's doing something, or a nurse, or anybody in there that's doing something that they don't approve of, guess what they're going to do? They're going to fire you, or they're going to keep you away from their patients. And, you can go to the courts and you can use that to go ahead and get in there. And the next step that they're going to do is they're probably going to try to take her license, because she's in line with the same doctors that were saying that, that masks are killing people because they're sucking up CO2 and all this other type of things. All these people, that guy lost his license too. And this lady here, she sounds like she's been watching, Joe Rogan and all of that. But, I've never seen a physician move without researching something through the proper channels and through the research channels before they start making accusations against the hospitals and against the medical establishment, and just go and do their own thing. So it's not looking good for her. But I will definitely keep my eyes on this one. You can bet that.
They could have suspended my privileges very quietly, but instead they took it straight to the media. I wouldn't be here right now if it weren't for them taking it to the Houston Chronicle. So I think they're trying to make an example out of me. I think they're trying to show people, okay, if you speak your mind, if you dare challenge the vaccine agenda, then this is what happens to you. You stand in front of your clinic with 20 reporters and, they beat you down.
Do you have an idea how many patients you get treated with?
A few hundred, probably.
And they're all okay?
They're all alive and well. I had one patient tell me she suffered temporary blurry vision, but she wanted to keep taking it nonetheless.
And just because a patient wants to continue taking something because they're afraid, you're supposed to be the person in the room who's thinking logically to take care of that patient. I mean, I've never seen a situation where they go, okay, doctor, you don't have to keep your head about you. You can just, be out here just as irrational as a patient who's in pain or who is maimed or whatever the case may be. You can just be as crazy as the patient is. No, they tell you to remain calm and to follow your training and to systematically take care of this patient. Don't get in your feelings now. You can get in your feelings later after the job is done. And unfortunately, I don't see that in her.
That's all I've had.
Doc, we talked this morning, you talked about what you want Methodist to now show
Right.
What do you want them to show?
Well, I want them to show all their data.
What's the significance of them showing all their data? You could have went and looked for that data. You said you had no data to support what you are doing. So even if they gave you their data, I mean, you're not going to use it. You're not going to believe it. You're just going to continue to treat these people with these, other treatments that who knows where the hell all of this stuff's come from, monoclonal antibodies and ivermectin and all of that. I don't know. I mean, basically, the first study was in vitro. Ivermectin works in a petri dish, not inside a human being. Okay? It's not the same thing. Bleach works in a petri dish. Not the same thing, people.
Have some data transparency. If they are so confident in their position, let's see it all. Let's see complications, complaints.
And why should they prove anything to her? She's trying to work for them. The burden of proof is on her. Show me what you have that proves that you are getting these patients well. Show me that the testing that you did was correct and that these people actually had COVID in the first place. You said you had 80,000 people tested. But her practice is only about 1,000 people. How the hell are you testing 80,000 people? You only have 1,000 people in your practice, but you treated 2,000 people. The math doesn't add up. What are you doing? Are you actively out here seeking patients? Are you under the table trying to get people, funneling people through your practice so that you can get more patients? Giving them false hope, possibly?
Let's see breakthrough cases. Let's see all their data.
Dr. Gold, have you been contacted by the Texas Medical Board in relation to anything that's going on in Houston specifically?
Well, no, not Houston, but there is an online group targeting me, encouraging the public to report me to the medical board.
Have you received any correspondence directly from the Texas Medical Board?
Yes, regarding the patient in Fort Worth.
So she has been contacted by her medical board regarding the patient in Fort Worth, the very thing that basically got her privileges yanked. So her medical board's looking at her right now. And, if it wasn't, if what she was doing was helping people, do you think that her medical board would be out here looking at her? Do you think that they'd be trying to take her license from her? And what she's afraid of right now is she's going to lose her livelihood because of her political leanings. People are getting caught up in this because of their affiliation to one side or the other, which medicine and science has never been and should never be affiliated with any political leanings whatsoever.
What do you say to the FDA? Because obviously you know that only medicines that are approved by the FDA can be given to patients, but maybe there's a problem.
This isn't off.
Okay, so she says that's not true, and that he says that only the FDA can approved medications by the FDA can be given to a patient. She says that's not true. Now listen to what she says.
Ivermectin before I started prescribing ivermectin, I went to the original study where FDA approved it for human use.
And what did they approve it for human use for? Anti-parasitic treatments, not for COVID. See, this is where people are getting it mixed up. Yeah, it's safe for use for anti-parasitic treatments, not for COVID. Okay?
I made sure to research the data and the safety. That was the first thing I did.
But she says she didn't have any data. So which is it? Do you have data or don't you have data? Because if you had data, you would see that basically the paper that was out there, the original paper, which I've read, it was pulled down. It was pulled from the publication because it was not upheld by the peer review process.
So it is definitely an FDA-approved drug. There's a difference. It's an off-label use of an FDA-approved drug, which is done very commonly.
Yeah, it's done very commonly, but not in the case of this drug. So don't lie to the people.
If you look at the data, the safety data, if you do a literature review of ivermectin and try to find patients that have died from ivermectin overdose.
Doesn't matter. Doesn't matter whether they've died or not. It's not recommended for treatment. This is all semantics. This is woman-splaining. I hate to say, but that's what it sounds like. I mean, she's rolling her eyes and looking all in all these different directions, trying to find something to pull out of her, her tailpipe to give you that will make you believe that her position is correct.
I challenge you to do that.
Ma'am,
And I would take that challenge.
how do you feel about this whole thing? How do you feel about this whole incident, this whole thing?
I mean, on the one hand, it's very stressful. On the other hand, I have been overwhelmed by the support that I've received. It is not what I expected. I have received support from Switzerland, Australia, all over the world. I think people are scared to speak up. And so it's been gratifying in that regard. I mean, I've created a lot.
So if you speak up and you don't know what you're talking about, that's a good thing. We have to be very, very careful with what's going on here because the implications of this are so far reaching that it is very scary. If we keep going the way we go here, no institution will be safe because anybody can come in and basically overrule whatever the rule is with a now later package with some scribblings on it. It doesn't make any difference because there'll be no process. There'll be no review process. There'll be no way for anyone of any standing to be able to counter what the person says because they can just say anything. They can just say, blue is red and, monkeys are fish. They can say anything and then you'll just have to accept it. But see, that's the world that we live in. We're in this world where, you believe a person before you find evidence, that what they're saying is true. You have people out here, using treatments for things from everything from hair loss to, erectile dysfunction. And it has nothing. There's no, not even the Food and Drug Administration will tell you that these things inside of these pills could be sand. It could be talcum powder because there's no way they can confirm what is inside these pills. And this is where we're going. And this is a medical professional that wants to go down that road.
A lot of enemies, but I've made many more friends. And so, I hope something good comes of it.
Are you a political doctor like the Methodists said?
Prior to COVID, I had absolutely no interest in politics.
She's lying. I gotta say, if you guys, I just don't believe that. I don't believe that. Just based off of what she said, the evidence does not lead towards a person who has no political leanings whatsoever.
I have been sort of forced into an area of politics, but prior to COVID, I had zero interest in politics.
How would you like this whole thing to end?
Eliminate the mandates. Let people have a choice.
Okay, that's a political position. That's not a medical position. That's a political position to eliminate the mandates for vaccinations. There's always been mandates for vaccination. You have to have vaccinations to go to school. You have to have vaccinations to work as a public service personnel. You have to have immunizations for medical school, for nursing school, for any kind of ancillary staff in a medical position. You have to have immunizations. For you to go to the military, you have to have your immunizations. Before you travel to any other country, you have to have your immunizations. Before you get a passport, you have to have your immunizations. But now all of a sudden, it's my body, my choice. And you know where that came from? That came from feminism. Okay? That's where that came from. And now it's being pushed over into something else by people who don't believe in feminism, but they're using it for their own purposes. And it's political.
And how they deal with COVID. Recognize that early treatment is effective, but most importantly, I mean, we all want autonomy over our body. We don't want somebody telling us you have to have an injection. I think that there's got to be protection for doctors that.
I bet you if you have to have an injection for a venereal disease, I bet you will, or sexually transmitted disease or STI, I bet you'll take it then. I bet you nobody's sitting up saying, well, I shouldn't have to have an injection. No, I've never had a patient tell me nothing like that. It never even came up.
Have concerns, and I think that we need to get the politics out of healthcare.
You just took a political position, but you want to take the politics out of healthcare.
You are listening to a Buki Cabal, the analytical savage.
Now ask yourself why these people are out here clapping for a doctor who, I mean, this is just the doctor who's basically coming out, who's basically, giving her position on, what's going on with a case that she has and with her clinic. What's with the clapping and all of that,
The God's lawyers here, if y'all have any legally kind of questions.
What? Can you give us your first and last name for us?
Steve Mitby.
So here's the lawyer. If you want to go back and you want to listen to the lawyer, I'll let you go ahead. I'll put a link down for that. So let's look at some of these tweets that the good doctor sent. First, we'll read this. Okay. The doctor. Oh, here we go. Doctor in Ivermectin lawsuit resigns from Houston hospital following suspension. Oh, so she resigned after the fact. Okay, so she gave a radio interview. Mary Talley Bowden said in a radio interview that the hospital is using me to show what's going to happen to doctors who speak out. That's a political position. Okay. So what are you speaking out against? Just say that you're not going to conform to the treatment methods that everybody else in the world are pretty much going by. Everybody. So here we go. A doctor involved in a lawsuit over ivermectin treatments for Fort Worth coronavirus patient has resigned from a hospital after the hospital suspended her last week. Mary Talley Bowden, a private practice ear, nose, and throat doctor who had provisional privileges to practice at a Houston Methodist hospital, was suspended Friday after spreading COVID-19 misinformation, the hospital said. I am a flea on the elephant of Methodists, Bowden said in an interview with KTRH AM, a Houston radio station, Houston talk radio station. And I wonder what their political, I'll have to look that up, but I'm sure that's a conservative radio station. However, let's move on. There is no reason for them to go after me like this. They are using me to show what's going to happen to doctors that speak out. Bowden said she sent the hospital her resignation Monday, and Houston Methodist confirmed her resignation to the Dallas Morning News. The hospital said in a written statement the doctor posted harmful personal and political opinions about the coronavirus and the vaccines that did not reflect reliable medical evidence as reason for her temporary suspension. Bowden had never admitted patients to the hospital during the time she had privileges, the hospital said. Media consultant Wayne Dosafino, whose firm was hired by the doctor, said Bowden feels like she's being beat up on for giving her medical advice and that she feels vilified. He added, that if Methodist doesn't want her there, that's her choice. Yes, it is. Okay. Bowden is at the center of a legal battle over whether she can administer ivermectin, a drug used to treat parasitic worms, to a COVID patient in a Fort Worth hospital. Bowden said she wrote a prescription for ivermectin, which Texas Health Hughley Hospital refused to administer to Jason Jones, a Tarrant County Sheriff's deputy being treated for COVID-19 complications, the lawsuit said. Okay. She said she didn't prescribe ivermectin, but it looks like she did prescribe ivermectin and had been prescribing ivermectin for an off-label use. And we're gonna do a quick search to see whether that off-label use is something that's justified. Maybe if I got time. Bowden said she recommended ivermectin after Jones did not respond well to other treatments and his condition deteriorated. According to court documents, Jones was hospitalized from September 28th with the virus and placed on a ventilator in a medically induced coma. Told you he wasn't looking good. October 7th, according to the court documents, his family is now suing the hospital to allow Bowden to administer the drug. So this family is reaching out for anything and everything because they're afraid that their family member is going to die. And sometimes we do things that aren't in our best interest, and try to get doctors to treat them the way we feel like they should be treated, and we don't even have a leg to stand on. We don't know anything. They probably were just on their phone looking for any and everything that they could use to treat these people. And somebody's got to have a level head. Okay. So here we go. It says ivermectin is not a part of Hughley's COVID-19 treatment protocol. And the hospital said the drug would be medically inappropriate for Jones, according to the lawsuit. Bowden said in a radio interview that she received complaints from the Texas Medical Board over the lawsuit. A spokesman for the medical board said it couldn't comment on whether Bowden had been sent complaints because such information is confidential under the state law, and it's confidential until they reach a finding. Okay. Bowden has not had any previous disciplinary action according to the medical board's records, but she's under investigation right now. And they don't want to say that, but she is. Ivermectin tablets are approved at some doses to treat parasitic worms in people, according to the FDA. And they have a link for the website. The drug is used in larger doses to deworm livestock. Okay? Small doses for humans, huge doses for livestock. Okay. While clinical trials into the drug's effectiveness in COVID-19 patients are ongoing, it has not been authorized or approved by the FDA preventing or treating the virus. Ivermectin also has not been approved for use against coronavirus outside of clinical trials by the World Health Organization or the drug manufacturer Merck. Okay? The American Medical Association, American Pharmacists Association, and American Society of Health Systems Pharmacists said in a joint statement that the group strongly opposes ivermectin as a COVID-19 treatment, citing insufficient evidence of the drug's effectiveness. Health authorities have urged people to stop taking ivermectin to treat COVID-19. Misuse of the drug can cause nausea, vomiting, diarrhea, low blood pressure, and allergic reactions. The Texas Poison Center Network said calls from people related to ivermectin have spiked in recent months. Okay, I'll link that, and that's the Dallas Morning News. Okay, here's an article from The Hill. Texas doctors' privileges suspended for spreading dangerous misinformation. Okay, here's her tweets. Mary Talley Bowden. Okay, what the government is doing to its citizens in the United States is incomprehensible. Thank you for what you do for your patients. God bless you and your staff. She says the vaccine mandates are wrong. That's a political position. But she wants politics out. Okay, I'll read this one too. The Houston-based doctor has had her privileges suspended. Okay, this is all because she pretty much resigned after that. Okay, there's the tweets. Okay, the physician's privileges, the Houston Methodists have been suspended. Muck said in an email to the Post. Bowden also used her account to promote the antiparasitic drug ivermectin as a COVID treatment. Ivermectin might not be as deadly as everyone said it was, Bowden wrote in a tweet on November 10th. Speak up. So she's encouraging people to rise up and fight against the authorities on ivermectin, which is nuts. That's crazy. That's a political position if you're trying to get your patients to do that. Okay. It says neither the Food and Drug Administration or the Centers for Disease Control and Prevention have recommended ivermectin, a drug used to kill parasites in animals and humans, as an actual COVID-19 treatment. Okay, here's another tweet she did. Ivermectin might not be as deadly as everyone said it was. Speak up. Okay, so then here's a person who put down there, ivermectin is effective for COVID-19, early treatment 67%, and she puts down these numbers, and then, but we don't know where these numbers came from. We don't know where the study is. 126 global studies. Okay, but what were they? Where are these studies? Because nobody is referencing these studies. So where is this stuff coming from? And you see the disclaimer that they're putting underneath. Learn about treatments for COVID-19, because these people are leading these people into misinformation, which she's probably going to get a license pull for that. Muck also said the hospital granted Bowden her doctor privileges last year, according to the Post. And like they said that she never even admitted anybody. So what was she doing over there? I mean, you're seeing all these sick people, and I'm sure there were sick people, but you didn't admit anybody? I mean, what are you doing over there? Okay. She's just the latest medical professional to be suspended for spreading misinformation about COVID-19 and ivermectin, a drug that former President Trump and celebrity podcaster Joe Rogan have both highlighted. And recent information has come out also that Trump had COVID not once, but twice, and didn't tell people that he had it. So, that's just crazy, but, just throwing that in there. Okay, Bowden's attorney, Steve Mitby, said in an email to the Post that his client has treated more than 2,000 COVID patients, reassuring them that she isn't anti-vaccine. Okay. Like many Americans, Bowden believes that people should have a choice and believes that all people, regardless of vaccine status, should have access to the same high-quality health care, Mitby said. Bowden's attorney, Steve Mitby, said in an email to The Hill that his client has treated more than 2,000 COVID-19 patients, reassuring them that she isn't anti-vaccine. Okay, well, they saying the same thing over and over. Okay, Dr. Bowden also is not anti-vaccine. Yes, she is. I mean, come on, y'all. I mean, you got to see that. At least don't lie to the people. Tell them you're anti-vaccine and say, look, I'm an alternative to it. Own it. Stand on your hill. Don't put one foot on the ground and one on the hill. So says she's not an anti-vaccine as she has been falsely portrayed, Mitby said in the email. And I don't know how you falsely portrayed. I mean, your tweets speak for themselves. You're not recommending the vaccine. You're not even recommending it as a choice. You can take the vaccine or you can take ivermectin. She's not even doing that. But if you believe it's a choice, then give the people the choice that you say that you're advocating. Okay, she recognizes the importance of the vaccine along with early treatment in responding to a global health crisis. She just doesn't believe that anyone should be forced to take the vaccine. Okay, she believes in early treatment. Well, you treat the early symptoms of it symptomatically. Whatever they show, you treat that. But the disease is progressively going to get worse. And there's not going to be anything you can do about it. If they get a fever, you treat the fever. If they get a shortness of breath, you put them on oxygen. If they're not eating, then there's not much you can do about that. You know, you can give them fluids, you know, keep them hydrated, you know, and once they can't take anything by mouth, I mean, you're going to be pretty limited as far as what you can do to these people outside of an emergent care or treatment center. Okay, so Dr. Bowden has the utmost respect for Houston Methodist and is proud of the work that she has done along with her colleagues at the Houston Methodist. Maybe continue. In a statement, the Hill Houston Methodist Hospital said Bowden's social media remarks do not reflect the medical evidence or the values of Houston Methodist, adding it will never deny care to a patient based on vaccination status. Okay. Dr. Bowden, who has never admitted a patient to Houston Methodist Hospital, is spreading dangerous misinformation which is not based in science, HDH said in their statement. Furthermore, Dr. Bowden has told Houston Methodist that she is vaccinated as required of all physicians who practice at Houston Methodist. Okay, but she wouldn't answer the information when she was in the interview, which is rather suspect. She might have lied, like what's his name? The football player. Can't remember his name right now. So, you know, there you have it. And it's pretty suspect.
You are listening to Abuki Cabal, the analytical savage.
So there you have it. You know, another snake oil peddler out here trying to make sure that people believe that they can treat themselves with roots and berries and ivermectin and magic salves and potions and Harry Potter spell books. And not science. But you're supposed to be a scientist. I mean, after you come out of medical school, you're essentially a scientist. You know, how could you go to medical school and not believe in science? You know, I guess money took the place of science and ethics. But that's my take on the snake oil peddling doctor. Yet another one. This is my third one yet. I will keep getting you guys the information that I think that is relevant to the times and the things that we are having to endure. And I hope you guys enjoyed the show. And I will catch you guys later. I think the next one, I think I'm going to deal with obesity again. All righty. You guys, please like, share, and subscribe. Doesn't take but a minute for you to hit the like button. Please support the channel, and I appreciate all of you guys. Have a good night.
I feel like a